Right. And good afternoon. Following a weekend of a lot of changes with staging and with also with the large number of public gathering size as well as with social circles. So a few things to talk about. And today we've got both Dr. Yaffe and I are here today on that to talk about a number of different aspects. So again, with our bi-weekly approach, we want to talk about what has happened over the weekend. So what's the trend and the direction? So Dr. Yaffe has some comments to make on that. And then where are we at and what are we looking for as the week goes ahead into next Thursday. So with that, and for the numbers and some look at the trends, hand things over to Dr. Yaffe.
Okay, thanks very much. Good afternoon. Since our last update on Thursday, several significant announcements and milestones have occurred. 24 of the 34 public health units in Ontario have officially entered Stage 2 as of June 12th, and a further 7 health units will be entering Stage 2 on June 19th. Social gatherings of up to 10 people can occur with appropriate physical distancing, and Ontarians can now establish a social circle or bubble of no more than 10 people who can come into close contact with one another. As we continue to relax public health measures, it is important that we maintain a watchful eye on our key trends and indicators so that the progress we have made does not go back in the wrong direction. The data over the last few days supports our continued and gradual reopening of the province. While there was a slight bump in new cases reported on Saturday, with 266 cases, the number of new cases has remained relatively low in recent days. A particularly encouraging trend has been that many of our health units have been reporting either no new cases or a very small handful. Of today's 181 new cases, for example, 28 of our 34 health units are reporting 5 or fewer cases, with 18 reporting no new cases at all. We also continue to see more Ontarians who are recovering from COVID-19 on a daily basis, more of those than we see new cases reported. While we do tragically continue to see deaths associated with COVID-19, that number has also been steadily declining, as has the number of people who are hospitalized. To date, 2,527 deaths have been reported, which represents an increase of 8 deaths since yesterday and 40 since last Thursday. Currently, we have 419 Ontarians in hospital, and that is a decrease of 19 from yesterday and 108 since last Thursday. While we have seen a few new outbreaks in long-term care homes in recent days, outbreaks in institutions are, by and large, declining. Our testing numbers have also remained above 20,000 tests per day since last week, while the percent positivity has continued to decline. We have now surpassed 1 million tests in Ontario. We are also now in the process of expanding data collection in Ontario for COVID-19 to help reduce the spread, and we are now posting for comments to add a regulatory change to mandate the reporting of data on race, income, language, and household size for people who have tested positive for COVID-19. This will help us to get a more complete picture of the outbreak and eventually allow us to prevent and control cases even better, while ensuring the privacy of Ontarians is protected. So what does this all mean? The numbers and trends are all headed in the right direction, and this is encouraging, but we do have to remain vigilant. And it's essential that everyone, regardless of where you live, continue to follow public health advice, including staying home when you're sick, practicing physical distancing from anyone outside of your own social circle, regular and thorough hand washing, and wearing a face covering when physical distancing is a challenge or not possible. I'll turn it back to Dr. Williams now. Thank you.
Okay. So all very good signs over the last few days with Our number of cases, except for the one day on when over 200, have been below 200. We haven't seen that for a long time. The 181 is one of the lowest ones since the earlier parts of March. And so that's encouraging. And our positivity rate has dropped down at one time to 1%. That is also quite unique and one that we're really pleased to see in that regard. And of course, then, as Dr. Yaffe alluded to, the number of resolved cases for a number of days in a row has exceeded the number of new cases coming in. So there's been a net drop in active cases within the province of Ontario. So these are all positive signs as we are moving into our first, we'll be completing a week of stage 2 shortly and adding the other 7 health units into that stage 2 as of this Friday, and continuing to open up and progress through the phased approach that we talked about originally as we watch the numbers across the province, the cases, and added to that the number of tests that will may even this weekend, where now we should see our drop. In the past we'd be well below 15 or 13,000 sometimes. We are staying above 20,000. So our testing numbers are staying up as the strategy is being rolled out in that regard. So it's not the fact that we're not looking for cases. We are continually doing more and more testing in many different sites and locations throughout the province, and we'll continue to expand on that as the need and direction of the strategic planning group determines. So with those things in mind, that we are, as I said, we have moved 7 more health units into the next stage, which they'll start on Friday, and it's hoped that the remaining ones will see how they do this week as we progress through, and then start to see over another week or so what has been the impact of stage 2. And I know there has been some comments as people have been out and around more, as the weather has improved, a bit cooler on the weekend. They've been out more, and a number of people, while adhering to the requirements of the new social distancing, so physical distancing in social settings. And some people keep asking why I use social distancing and physical distancing, because I think there's a social part of recognizing and being sensitive to someone else and staying that distance besides just demanding physical distancing only. And so when they're seeing that, they're still seeing some cases where people are in crowded situations, not taking their turn and time and going into especially close quarters and facilities to do some business, retail, or purchasing. And also a number of people are still not wearing then a cloth, fabric, a facial covering in those situations where they can't maintain the distancing. So, and this is not true in our large urban areas. It's also been noticed out in some more of the rural areas too. So even though we're going to this phase, we still have to be vigilant, as Dr. Yaffe used the word, in undertaking this carefully, because we've seen already some other jurisdictions that are starting to have some potential secondary waves and resurgence of cases, especially at outbreaks. And in Ontario, after all our investment, we would not want to have that happen. And so therefore, even as they're going out the gate, as I used the analogy last week on Thursday of like the start of a race, and that's where we use the social circles and that kind of stuff. You've done all this time training, getting ready, and then when there's a big crowd at the start line, if everybody just goes off in a frenzy, people howl on top of each other, some get injured, and you don't want to do that. You need to concentrate on those around you and to be observant of your pace and step on that. And then in time, you'll be up to the full pace of the whole thing. So we have to be cautious as we go out the door here. We're expanding, but we have to be more careful. We're allowing more outside, but you still have to maintain the distancing. And now you have your social circles. You have to do that in a way that maintains that contract with each other to be one that you have not had exposure, that you will not take unnecessary exposure to basically impact the group, and you will be prompt and reporting if there's any concerns or issues to the others in that group. That's for this next 2 to 3 weeks as we start to get everybody up to, if we hope soon, up to stage 2. So this coming week, we want to watch again these numbers. Now that are not, that's that transmission rate you hear that we hope is going to be below 1. It is below 1, and we're moving down there. We'd like to keep pushing that down further. That means less and less community transmission in that sense there, and reducing numbers week over week. So we're into this next 2-week period, and that's watching how the impact of stage 2 is going to do, as well as the other methods we put in place. As we open up, we become more careful, and we watch that and are paying attention to that. So that's our general message of what has happened and what's coming up in the week ahead. And so we need to observe those and to keep the messaging going out of what we need to do, what we can do, and more importantly, what you should be doing to make sure that we're moving steadfastly towards, as we said, not only flatten the curve, but bringing it right down. And ideally, it'd be nice if we could even say we could put ourselves in a position to prevent a second wave, but we got to be good at this stage, so let's do our best at this time. And thank you for all the work you've done on that, and I know that you will be doing in that regard in the next 2 weeks coming up. So with that, we're going up for questions.
Okay, we'll go to the phone lines. Just a reminder, one question, one follow-up.
Your first question comes from Kelly Grant with the Globe and Mail. Please go ahead.
Hi, Dr. Yaffe. I wonder if either of you could just explain to me why you think Ontario's case counts have dropped so much in the last week.
Okay. It's a good question. I like that one. And we have been watching as we watch the amount of transmission as you go through the 2 week quarantine periods and the people still being, for quite a bit of the time, being very careful about those contacts. And so your contact and potential spread is reducing. Health units are getting more on top of the case contact management. They're identifying more related to outbreaks, quickly containing those outbreaks, monitoring those individuals carefully. And the I guess the data side shows you that the transmission rate was dropping from 1.2 to 1.1 to 1.0 down to 0.9, and some even touched down today as close as 0.8 and a little bit below 0.8. That means our transmission rates are dropping off across the province, and I think that's really exciting to see because we're seeing we're coming down off that epidemic curve. That means it's encouraging and we're doing what we should be doing. We just need to keep doing that because I would like those numbers way back in those days of late February when we were saying we got up to numbers like 60 or 80 in a day. And it'd be nice to see those happening again because some of the other provinces are down to where they hardly have more than 10 or 15 cases a day, and some have seen none. Now, they're a lot smaller, be that as may, but I still think we would like to get that number down even further. So encouraging, good news. People are doing what they should be doing. Now we're in stage 2. Let's not bounce that back up again. Let's keep those numbers driving down is what I'd like to see.
Follow-up?
Yeah, can I just try a bit again? So do you think it is better contact tracing? It just seems so surprising to me that there has been more of an opening up over the last couple of weeks. So one would think cases would have either plateaued or perhaps even gone up. And I'm not talking about the reopening that was as recent as Friday. I'm talking about the beginning of the reopening a few weeks ago where you'd expect to see the results of that. Do you think it's anything other than better contact tracing?
Maybe
Sure.
I'll pipe in. I think there's a whole host of factors. And I think part of it is the increased access to testing. So people are going for testing earlier when the symptoms just begin. And so hopefully they're isolating right away, and so there's less spread. I think as you know, we have less outbreaks in long-term care retirement homes due to a whole host of things that have been done, interventions, and those are very high-risk groups, so we have less cases there. I do think there has been, as the cases go down, the case and contact follow-up is done more in detail because there's less to be followed, and so I think there's a whole host of factors. It might be something in the natural history of the infection, but we know it's around, and we know that if we loosen our controls, we will get it again. So we can't be we have to be vigilant.
Okay, next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, doctors. Don't mean to be a party pooper, but I noticed that over the weekend there were 6 more outbreaks in long-term care. Do you have any detail on those? What's happening, and your level of concern?
I don't have any detail on that, but I do know that long-term care, the incident management system is still active. It's still a high priority, and in long-term care facilities that are problematic. The management's being taken over by other, like the hospitals or the ministry, and so we'll act very quickly when there is an outbreak to get it controlled.
And this is actually the last question.
Okay, I'm good. I'll pass my follow-up to someone else.
There's no one else on the line. Rob, are you sure?
Yeah, I'm good. Thanks, everyone.
Okay, thank you.